Hey guys, first of all, I want to say that I don't know if you can see it, but I just woke up from my nap and you can see where my CPAP machine is, and it leaves a lovely mark on my face. So, I have to take naps because of Luke, so he's at school, and now I feel refreshed because I've got at least 6 hours of sleep in without being bothered. Anyway, the reason I'm doing this vlog is because I've had several people ask me, some of my MySpace friends, ask me about surgery, what are the different types of surgeries, why I chose the gastric sleeve, how is it different, financing options, the things I found out about Mexico, um, and my surgeon. I don't know if I said that or not, but at the end of the blog, which I've only got 10 minutes, and I found that out the hard way because my first video was rejected because I talked too long. So, at the end of it, if I have enough time, if I don't have to edit anything, I will put his name and information. He has a website, and there's more information than what I could ever tell you. I can just kind of recap it because, I'm not an expert. So, first of all, to the people that ask me about surgeries and different types of surgeries, there's two different types of weight loss surgery. There's restrictive, and I'm sure I'm going to pronounce this wrong, but malabsorptive. Um, the gastric bypass is both restrictive and malabsorptive. The lap band is just strictly restrictive. Um, the gastric sleeve is strictly restrictive. I know there's some other ones out there, like the duodenal switch, which is both restrictive and malabsorptive. Now, what that means is the restrictive part is when they um, make your stomach a smaller size, which would be about, excuse me, I got something in my eye. Um, that would be restrictive. Now, when they like reroute your intestines, or like a part of your stomach to the intestines, that decreases the amount of calories and like minerals and nutrients that your body absorbs. And that's where a lot of people, when they have gastric bypass or those kinds of surgeries, they have to take a lot of replacement vitamins and stuff. But it's a good surgery to have. Um, I did not want to do gastric bypass because I'm not comfortable with having my intestines rerouted, at least at this point. Um, the duodenal switch was something I was very interested in. But at this point, I, dang it, I forgot to turn the sound off again. Okay, I'm going to have to turn this off because that's very distracting. Okay, anyway, so, totally lost my train of thought. Okay, got that taken care of. Anyway, so the duodenal switch is something I was interested in, but it's kind of like gastric bypass. Now, I don't know, well, first of all, let me just go ahead and tell everybody, and let me just get this completely out of the way. Obviously, you can tell from my videos that I'm overweight. Um, I am, and sorry I keep saying, I keep saying a lot. Anyway, and I say anyway too. Okay. But I can't think of anything else to say in replace of that, so just have to deal with it, I suppose. Let's see. My current weight is, well, first I should say I am 4 foot 11 inches tall, which is 1 inch away from 5 feet, but most people don't hear that. They just hear the 4 and they completely freak out. So, yes, I am 4'11". I currently weigh 314 pounds. Um, I know that with obesity and morbid obesity, you have to have a BMI of 30 in order to be considered morbidly obese. Well, mine is now at 64. And because of that, that's one of the reasons why I chose not to have like gastric bypass or the duodenal switch, is because I guess I have a greater chance of having serious complications with the surgery if you have a BMI of 60 or over. I'm at 64, so, I want to lose weight, I want to have the surgery, but I really don't want to have complications. So that's why I'm choosing the gastric sleeve. The gastric sleeve is a you can use it as just a standalone procedure. And what that does is takes 3/4 of your stomach, and it leaves part of your stomach. They call it the sleeve because it looks like a banana, a very small banana. But I don't know if I'm pronouncing this right, but it's called the pylorus valve. That is still intact, whereas in gastric bypass, it's not. So people that have gastric bypass, they have what they call dumping syndrome. Um, if they eat sweets, it's kind of like their body goes into shock because it's like immediately hits their system, and then, I'm assuming it's like a hypoglycemic episode, which I do have hypoglycemia, so, I'm trying to avoid that at all costs because, I know that's going to happen, and why would I have the procedure? But it also, some people like it because they know that if they do eat sweets, then that's going to happen to them, so it's kind of a deterrent. But I chose the gastric sleeve because it is for people who are 60, have a BMI of 60 or over, which is myself. It can be a two-part procedure for the duodenal switch. So if I get the gastric sleeve and I lose enough weight and I decide later on that I want to have the duodenal switch completely, where they reroute the intestines, then I can have that later, and I would be a safer weight to have the surgery. Or I could have gastric bypass. But that's why I chose the gastric sleeve. There is no dumping syndrome. There is no malabsorptive procedure, so I shouldn't have a lack of nutrients, things like that, because I have some issues with my, warning, TMI, my periods. They're just like horrible, and I think the doctor told me once that I have PCOS, and he wanted to, after I had my youngest, they wanted to put me into, gosh, what is that, menopause, and so that I wouldn't have my periods anymore. Well, I'm like 31 now, and that just doesn't sound good. So, anyway, I'm hoping that with the weight loss, because I've seen other people that have PCOS and have had the surgery and they've lost weight, and I'm assuming their periods have gotten better. But I have to take iron supplements because it's just so awful. So, anyway, that's why I chose the gastric sleeve. Now, as far as financing, um, about, and those of you that worked with me at the encoding center at the post office, excuse me, y'all know that I was sick for about 6 or 8 months before they finally figured out that when I was on one of the mini diets, I was on Weight Watchers, and I was eating a lot of like artificial sweeteners, things that had, Splenda or whatever in them. So I can't have that, and I was having an allergic reaction to it, but it took me like 6 months to figure that out. So, but during that time, I wasn't getting paid. So anyway, long story short, we had to file bankruptcy. My credit's shot. Even though I paid it, we paid off our bankruptcy. We're in good standing, and we're in the process of reestablishing our credit. That doesn't really matter. So, let me think here. I've applied to, I would say, like 10 or 11 different surgery financing places. And if I had a halfway decent credit score, I probably would have been able to get financing. But I was not. So, this is what I did. My doctor, well, if you call the doctors and you say, I'm a self-pay patient, how much would this be for self-pay? That's what I did, because their self-pay patients get a cheaper price than patients who are doing it with regular insurance. I have insurance, but insurance doesn't cover it. They used to, but they don't anymore.